PCOD different and PCOS different?
So this is where all the influencers make their money, right? They say PCOS is different, PCOD is different, separate diet for PCOS, separate diet for PCOD. It's pretty much all the same.
When it comes to infertility, it's always a woman which is, who's
usually
always,
blamed, right? That's not in any other part of the globe.
True.
In India, even if it's a boy baby, they'll say it's the woman's fault.
Yeah.
But frankly speaking, it's the guy's fault, right? So earlier, the normal sperm count was supposed to be 50 million, just 10 years back. Now can you guess how much it is?
No.
15 million.
Oh, have you ever come across like an annoying reel?
Of course, there was this one where they showed that, using tuning forks to cure PCOD.
That's interesting.
Yeah. 10 women who come into my clinic, 8 of them have PCOD. And out of these 8, 2 of them have resistant polycystic ovarian syndrome.
One thing everyone should know about IVF.
That it is not 100%. Every Sunday at 3 a.m. I just go out, I see people standing in line and having biryani at 3 a.m. I don't think PCOS or PCOD requires treatment. It has to be only treated when it gives you problems.
Yeah, I think made a lot of controversies.
It's our job, right?
Yeah. Hi, welcome back to the Monisha Aravind show. So, in the episode, நம்ம திரும்ப ரொம்ப முன்னாடி பேசின அதே ஒரு ப்ராப்ளம் பற்றி தான் பேச போகிறோம், பட் வித் சம் மோர் இன்ட்ரெஸ்டிங் ஃபேக்ட்ஸ் அண்ட் பிரேக்கிங் த மித்ஸ், ஃபர்டிலிட்டி இஷ்யூஸ் பற்றி தாங்க. ஏன்னா அஃப்கோர்ஸ் இட்ஸ் த ரைசிங் ட்ரெண்ட் அண்ட் நிறைய பேர் வந்துட்டு என்னை பர்சனலாக பார்க்கும்போதும் கேட்டிருக்கீங்க, என் கிளினிக்லேயும் கேட்டிருக்கீங்க, டிஎம்ஸ் பண்ணியும் கேட்டிருக்கீங்க, லைக் ஹவு டஸ் த லைஃப் ஸ்டைல் சேஞ்சஸ் அஃபெக்ட் ஃபர்டிலிட்டி இஷ்யூஸ், இது உண்மையா பொய்யா, அண்ட் டே டு டே கண்டிப்பாக ஏதாவது ஒரு ரீலாவது இதை பற்றி பார்த்துருவீங்க. இட் குட் பி அ மித், இட் குட் பி அ ஃபேக்ட், still confused, right? இன்னைக்கு இதை பற்றி தான் நம்ம ரொம்ப டீட்டெயில்டாக பேச போகிறோம் with Dr. Surakshath gynecologist. Hi sir.
Hi Manisha. How are you? All good.
Good. Thank you for accepting the invitation to be in the podcast.
Thank you for having me.
So before starting, of course the entire episode is going to be about breaking the myths and all that, but before starting I always see you posting interesting replies to lot of reels on Instagram. Why did you start doing that?
I think the most important thing is, people are averse towards education. Nobody likes to get educated, or at least they come to Instagram, they don't want to get educated. They want to be entertained, right? So when you have an entertaining content, use that content and try to get, and try to propagate your message, or in case, educate them in a way where it's fun, like how our class teachers used to do, no?
Yeah,
something like that.
Yes, but I have to accept it's definitely very funny and it's very engaging to watch like what you are about to say on a particular reel or information. And have you ever come across like an annoying reel or like really stupid reel for that matter?
Yeah, I think most of the ones which I usually react to are the ones which are obviously not logical. Of course, there was this one where they showed that, using tuning forks to cure PCOD.
Okay. That's interesting.
Yeah, it was. So then I had to talk about it and people were very interested to know what I had to say about it as well. So yeah, it was quite interesting.
Okay. So this reaction that comes out of you when you see that reel, are they like the first reaction that we get to see, or is it like an edited reaction that we get to see?
Actually, all of those reactions are edited. I just edited once and they use the same thing over and over again.
Okay.
But ideally, I would be like, one more of this.
Okay.
Yeah.
All right, great. Getting into the topic.
Yes.
When it comes to fertility issues, I don't want to address it as infertility. Basically, probably I can put it as fertility issues. It's in a rising trend. Have this always been in a rising trend, or is it because of social media that we are getting to know more about it, or is it because of our lifestyle changes that we are ending up with a lot of fertility issues nowadays?
So if you look at the statistics, right, in the past 10 years, earlier the normal sperm count was supposed to be 50 million.
Okay.
Just 10 years back.
Okay.
Now can you guess how much it is?
No.
15 million.
Oh,
so from
my
50
God.
it came to 15 as a WHO standard. So what does this show? There is a decline. Whether we like to accept it or not, or whether it's the lifestyle, it's the environment, it is so many factors put together, you are having a declining in the fertility rates. That Of course, also coupled with social media, and of course the amount of marketing all the IVF clinics do, all of this put together, you do have this rising trend.
Okay, so what do you see as a major cause here?
Major cause for infertility,
Yes,
again, as I said, it's a couple of factors put together, but I think in the recent days, at least in India, it's the lifestyle factors.
lifestyle factors. When we talk about the lifestyle factors, what are the certain lifestyle factors which is contributing to it?
I think our diets.
Okay.
More than anything else, it is the diet, because even smoking and drinking has been there for quite a long time. But the kind of diets what we are having today, if you just think back 4 or 5 years back before COVID, how many of us were actually going out and having food, right? Now you look every Sunday, at least in Ananagar, right?
Ananagar is a hub.
Every Sunday at 3 a.m., I just go out, I see people standing in line and having biryani at 3 a.m. Now you tell me, is this a good trend or not? And obviously, if
Definitely
this
no.
is not going to have some, a risk on your health, I definitely think nothing else will, right?
Of course.
Yeah.
So it's 90% our
It's a
diet.
diet, yes.
That plays a huge role here.
Yes.
Okay. But I don't think it's going to anyways change. So what do we do? What do we do to ourselves to escape from issues like this? Again, until someone gets married and they want to have kids, I don't even think this it's them.
Or
Yeah.
if they are of, above 30. I see a lot of women who are above 30, right? They do, they are quite aware of the things what are going around, and they do plan for, egg freezing and other things. But if you look at it for men and women, it is different. And I think men should really focus on working out, trying to get their health back in check. And I think women, again, have to focus on their diet, making sure they're taking the right calls. So, both for men and women.
From both men and women.
It
And
is-
when it comes to infertility, it's always a woman which is,
Who are
who's
usually
always
blamed, right?
blamed. So what is the impact of men here? So how much do they have to put in an effort to, like at least prevent fertility issues?
No, it's a very important thing, Both men and women are equally responsible. If you look at the statistics worldwide, it's almost 50-50. As in 50% are the male factors, 50% are the female factors. So definitely both of us have an equal, share to play in this. But only thing is, unfortunately, in India, that's not in any other part of the globe.
True.
In India, people
It's
just tend
always-
to put things on women. Even if it's a boy baby, they'll say it's the woman's fault.
Yeah.
But frankly speaking, it's the guy's fault, right? So really can't do anything about it.
Okay. Yeah, I think you have to put this factor more clear in your reels in future that it's the guy's fault.
Yeah, of course, the ones which in fact, there was one of these reels which got viral again, saying that it's the guy who's responsible for the male or female to determine the sex of the baby. And that again went viral. So yeah, people are getting to know and are getting educated in a funny way.
Yeah. Hope we see a change
Yes,
soon.
yes.
But I think this is again more in the rural side.
It's very much even in the
Urban.
cities also.
Okay.
Yeah.
Yeah. And again, like when I see your stories, I see that you go even to the rural areas too
Yes.
and do some camps.
Yes.
Do you see the same infertility issues there too, or is it the city which is affected more?
It's a very good question. I think yes, the kind of issues what I find in the rural areas are different than the ones which are over here. In the rural areas, when I do the camps, the number of patients who do have polycystic ovaries are very less.
Okay.
And if they do have polycystic ovaries, they have the resistant kind of polycystic ovaries. They don't have the regular PCOD body. So of course there are various types of polycystic ovarian disease, because I've seen them in all their varieties. And the ones which are the worst to treat, the ones which you see the surgical procedures what we do, are the resistant ones.
Okay.
And if in case they have PCOD in the rural area, it's always the resistant ones. Over here, we do have also patients who are ovulating, who don't have any, ovulatory issues. And yeah, that is the main difference.
Okay. So now when you talk about the PCOD drilling,
Yeah.
so what does it actually mean and who requires it?
So this is for a very, I would say, out of the 10 or 15 women who come into my clinic, just take it as 10. 10 women who come into my clinic, 8 of them have PCOD.
Okay.
8 of them, right? And out of these 8, I would say maybe around 2 of them
Okay.
have resistant polycystic ovarian syndrome.
Okay.
And they're the ones who will require drilling.
Okay.
So what it means is that these patients, even if I give them injectables to force the eggs to release, they don't release the eggs.
Okay.
So I need to go and manually break the shell of the egg.
Okay.
In very layman's terms, break the shell so that
so
it
that
will start
gets
ovulating.
released. Okay. So again, when it comes to PCOD, PCOS, what is the difference? Are these two the same factor what we are talking about, or is PCOD different and PCOS different?
So this is where all the influencers make their money, right? they say PCOS is different, PCOD is different, separate diet for PCOS, separate diet for PCOD. It's pretty much all the same.
It's all the same.
You have to look at PCOS as the Rotterdam criteria, which is basically standard. You have the polycystic ovarian, look on the ultrasound scan. You have huge ovaries. You have high androgen levels. So they have like 4 characteristics, and 3 out of them have to be true for it to be PCOD.
Okay. So apart from the regular symptoms like, they do not get their ovulation or they do not get their periods on time, generally I see a lot of patients walking into my clinic with acne, hair thinning and excessive facial hair growth. When I see this all put together, or when I see an acne or hair fall or hair thinning is not responding at all, very resistant, being treating for many years, I keep insisting them to go get checked with a gynecologist to rule out if they have PCOS. Now, most of the time, according to a common man, it's just the irregular periods. So what are the other symptoms or signs that they have to look in to go meet a gynecologist?
I don't think PCOS or PCOD requires treatment. To tell you frankly, it has to be only treated when it gives you problems. When does it give you problems? Number one, it is giving you this excessive hair growth, or you have the hair loss, or you have the acne, right? So when these issues are there, you meet the dermatologist, and then they will give you whatever, retinol and everything else which is going to help you clear the acne, maybe laser for the hair, and obviously PRP and everything else for the hair thinning, right? So these are the symptoms, and the cure has to be directly given by the dermatologist only. There's nothing that we can do. Putting these girls who are most likely in their 20s on oral contraceptive pills is actually a waste of time.
Okay.
So I would definitely not recommend anyone to do that, because it is not going to help them in any way.
Okay.
It is not going to lower their testosterone levels in any way possible.
Okay.
As far as fertility is concerned, when should they come and seek treatment is, of course, they have been trying for 1 year to conceive. She and her husband have been trying, but they are not conceiving, at which point they will go to the hospital where they can start off ovulation induction, super ovulation, PCOD drilling, and maybe at the end IVF.
Okay. So ovulation induction is in just oral forms, or is it going to be like procedural forms? And you also mentioned about super ovulation induction. What does that mean?
So ovulation induction is a thing which is pretty much done everywhere, where basically you give medications to, for the ovulation to happen, and they will just track the follicle and see when the ovulation occurs, most likely in the fertility window on the 12th day, 14th day, 16th day. And on that day, they'll inform them whether the ovulation has occurred or not. And then on that particular day, both the husband and wife are together. In terms of super ovulation, we are not really looking for that one egg, but we are releasing 4 to 5 eggs from both the sides.
Okay.
So you give them injectables, you track these 4 to 5 eggs on either side, and then when they are released, then the chance of their pregnancy is more, because more number of eggs are there, more chance of pregnancy.
Okay. So when you do super ovulation, there are also more chances of multiple pregnancies. Is that possible?
Actually, in our Indian, for our Indian women, the chance of multiple pregnancy is very less.
Okay.
Very less. I have never seen a woman who we had done super ovulation for and who had multiple pregnancies after that. Of course, it is much higher in the Caucasians. In fact, that is the reason why they don't go for super ovulation for them, they only have 2 alternatives. Number one, go for the ovulation induction. If it doesn't work, they go directly for IVF. So they don't do the whole super ovulation. Unfortunately, in India also, they follow the same things what they follow there, because they feel, you know, their guidelines are better or whatever it is. But so many of the women who we treat, super ovulation, they conceive. So they don't really have to go for IVF.
So again, following you,
Yeah.
I know I have seen you posting a lot of videos saying you don't need IVF
Yes.
in few scenarios.
Yes.
Are you completely against IVF, or you do not choose IVF only for particular patients?
I'll tell you something. I'll give you one very good example. My father, you know, he's probably one of the first few people to have started IVF in Chennai.
Okay.
Okay, so he was practicing IVF for past 35 years. I have a full dedicated IVF unit in my hospital itself. The reason, and even till today, from the time we started till today, we do a maximum of 10 cycles per month.
Okay.
10 cycles per month, which if you go and talk to an IVF specialist, they'll start laughing, because they do a minimum of around 100 cycles a month, and they are so proud of it. See, the problem is we don't have IVF requirements to that level at this point of time.
Okay.
It's only that you don't, how much time are you willing to dedicate to your patients? Number one. How much time are you willing to, you know, guide them in the right way? And how much you don't put them down. Because the moment they go into an IVF clinic, the first thing they say is, this is a problem, IVF is the only option, please go for that. So I'm against that. If you do have some, if you have a reason for it, IVF, there's only two reasons I would say. Number one, if in case the sperm count is very low, there's absolutely nothing we can do. We have to take the eggs outside, because we have only like few sperms to select from. Maybe we have 10 sperms. We want to take the eggs outside, you want to take each sperm, make the embryo, and then transfer it. That is one option. The other thing is, if the tubes have got damaged, completely damaged, maybe because of some infection or some other reason the tubes are damaged, at which point you have to go for IVF. Now, how many of these, people who are going into the clinics have these two issues? Very less. I would say around 10% maximum.
Okay.
The problem is nowadays they use every other indication as well. Even for PCOS, people are doing IVF, which again is detrimental, because you do IVF for someone who has PCOS, they look like they're getting a lot of embryos, but they'll end up getting very few number of embryos. So, all of this, right? And then again, what happens once you go for an IVF? It's an IVF again, if it fails.
Yeah.
Right?
Yeah.
So, I think that is definitely the whole way the marketing is right now in the gynecology, and that is what I'm against.
Okay, so not against IVF, it's only...
I have a dedicated unit. My father has been in this for 35 years. If I'm against IVF, he'll kick me out.
All right, okay. And you also mentioned about egg freezing.
Yes.
Now, what is the success rate of egg freezing? Does it actually help?
This is also a very important question. I think many people need to know this. The reason is not because egg freezing is a sure shot thing, right? It depends on when you freeze it, right? If someone who has frozen their eggs at around 20 have a much better rate of that to become an embryo than when they are 30.
Okay.
But unfortunately, what's happening nowadays,
It's
many
when
of
30
them,
hits, yeah.
after 35, they're thinking of doing egg freezing, right? They're like, doctor, is this the right time? I mean, this is not the right time. But if you have it in your mind, do it off immediately. Right? So that is the whole idea.
So who should go for egg freezing?
I think people who know for a fact they are going to delay their pregnancy should go for egg freezing.
That's all?
That's all, yeah.
Because I see a lot of people even with low AMH going for egg freezing.
Yeah, that is unfortunate. The reason is because low AMH has very less significance unless this low AMH is also associated with low ovarian volume.
Okay.
But nobody does that connection, right? They just see low AMH, they feel, okay, my eggs are going to be low. That's not the case at all. So only in around 5 to 6% of these patients who have low AMH truly require egg freezing.
Okay.
Because they are in the process of losing all their eggs much earlier than somebody else, which is called as premature ovarian insufficiency.
Okay, so only for them.
Only for them.
Yeah.
Yes.
Okay. Now, as I said, I see a lot of patients coming and
Yes.
asking low AMH. I'm going to do egg freezing.
Yeah.
Like, okay, fine. I leave it to your gynecologist to take a call.
Yes.
Yeah. The fear, why? most of even my patients, for that matter, when I tell them, just go get a consultation. It's like, I do not want to take medications because for PCOS.
Yeah.
But if at all, I always feel that you need to just get an advice. Not that everyone is going to put you on oral medications.
No, everyone unfortunately puts you on medications.
Okay.
You go to a gynecologist, you will be surprised if you come out without taking any medications. So yeah.
Okay.
I'm probably one of the very few people who don't put you on medications. Will probably tell you what you should do. But then again, because medication is not going to do anything for people who are PCOD.
Okay.
To tell you
Absolutely
frankly,
nothing.
the OC pills which people put on, in fact, it's not going to help them at all.
All right. Okay.
Just this, many people have this satisfaction that they're having regular periods, but it's all induced, isn't it?
Yeah. You just got your periods induced.
That's it. That's all.
Okay, fine. Now we have, I think, made a lot of controversies.
It's our job, right?
Now, when we talk about addressing, like if they're planning for pregnancy and they want to make their lifestyle changes, when should they ideally start? Like, okay, I'm going to plan, so I'm going to start eating healthy, I'm going to take care of my health. It all starts like a year before, or what is the impact of like how many years or how long they've been doing it?
I think the most important thing is depending on which year they're starting off, right? So if you're starting off at around 20, take a year's time. I mean 22, 23. Somewhere around 30, I would suggest take a year and get it done. If it is 35, 6 months. And if it is beyond that, 37, 38, go to a specialist first, figure out if you can wait for that long, and then take your next step.
Okay. So when we talk about, again, infertility issues, the most commonest problem faced is stress.
Yeah.
Stress by themselves. They're getting stressed because they're doing a lot of changes to their life, because of the hormones and because of the people around them. So doesn't the stress itself induce fertility issues again?
No, absolutely. In fact, I've seen the people who conceive are the ones, they usually go on a trip. And that's when they conceive. They've been trying like maybe for 6 or 7 months, doing all kinds of fertility treatments, and then finally they just give up everything, just go for a trip, and during that time they conceive. So I've seen that happen a lot of times. So definitely stress plays a huge role, and there's a lot that we don't know as specialists, right? Even though we act like we figured out everything, there's a lot we are still learning.
Yeah. So now there are again a lot of people who influence, for stress reduction. There are a lot of drinks coming up to induce, like
green juices.
To address the fertility issues, and also there are a lot of they do take a lot of classes, to address the fertility issues.
The funniest thing, right? I made a reel recently saying, eat this laddu or drink this detox tea and cure your PCOD. I say that.
There is no cure for PCOD.
I say that, and the very next line, right? I say, if someone has told you something like this, run away in the opposite direction, right? You'll see my top comment over there. Sir, please tell me more about this detox tea and laddu. So people want to know if there's a shortcut.
Yeah.
So I've understood. That's where I understood that, people don't really care what you have to say. They just want to know there's a shortcut. They want to take it. And when these influencers give them these shortcuts, right?
They try.
Obviously, they want to go for it because they have like 1 or 2 patients who would have got like these positive results. Using those reviews, they plaster it all over the wall. And someone is going to get, fooled into it. And if you look at it, and I'm sure you also would have noticed it, many people are very gullible, right?
Yeah.
They just believe whatever is there on the internet, right? And that is what is very unfortunate. And I think that is where doctors like you and me have to break that trend and try to at least put a little bit of sense, if not in the majority of the people, at least in a small portion of them.
Okay.
I think that is what we have to do as doctors.
Yeah. So do you think those, there are a lot of legumes, there is this detox tea and all that. Does that by any chance affect or actually cause more problem to their existing issues?
It might not cause problems, but what it can cause is that it can cause uncertainty, right? and it can cause a lot of unnecessary waiting, and in times where we can really save the
Time.
patient's fertility, right? Maybe someone is promoting a drink for low AMH, and there people are promoting something for low sperm count, right? And these people waste their time and energy trying all these detox teas and everything else. Trust me, if some detox tea was there which was really bringing or increasing the sperm count, you think our medical fraternity will leave it? They'll be the first one to make a study on that and put it as a product, isn't it? So there is no way that science or something has crossed science and doing something better, even if it's Ayurvedic. Any Ayurvedic medication, if you look at it, Lactar was once an Ayurvedic medication.
Yeah.
It's now used
Yes.
In our modern
Modern
medicine, isn't
medicine
it?
too.
If it
Yeah.
has science to it and it has some data to show it works, trust me, we've already taken it.
We have already done
We've
that.
already done that. So whatever anyone else is saying, of course, it may or may not work for the person, but not for the majority of the people. What medications we give works for the majority of the people.
So once the sperm count goes down,
Yeah.
are there any ways to increase it?
That's a good question. So depending on why your sperm count is reducing, right? Are you taking any medications? Are you exercising a lot? Are you doing something? Are you stressing too much? Are you doing bicycling? So there are certain factors which can bring down your sperm count, and when you stop those harming factors, it will come back.
But what are the other reasons for the sperm count going down?
Other than
Other than
trauma and
yeah.
environmental factors, genetic or
Okay.
mumps. Many people who got
okay.
affected with mumps as well, they do have
Reduced.
low sperm counts. Yes.
Okay. So can you share like 5 practical things a woman can do to improve their ovarian reserve?
Yes. You cannot improve your ovarian reserve no matter what.
Okay. To improve the egg quality?
Again, egg quality is something which we cannot directly control.
Okay.
The only thing what people have found is ovarian rejuvenation, where basically how you inject PRP in the hair, we inject PRP in the ovary just to improve the better blood circulation in the area and hopefully cause a little bit of traumatic thing. Obviously, right? If you do have some trauma in the ovary, you are going to have the regeneration and
Okay.
the inflammation and everything which can cause an ovarian rejuvenation. So that's the only thing that you can try if you want to focus on that. But otherwise, your usual lifestyle hacks
All right. Okay.
are what is going to help, like your antioxidants, are what are going to keep your ovaries in check.
Okay. So how does PRP help? Like you've told me the mechanism of how it works, but have you seen like good success rate in this, or is it really working well to improve the ovarian
It's a very
rejuvenation?
good question, no? Again, as I said, the data is very scarce. The problem with PRP is not the fact that we are injecting PRP. We don't know how many times to inject PRP. We don't know what concentration we need to prepare this PRP. There are so many factors about PRP, we just cannot put it under one bracket. So right now what we are doing is we are experimenting with various things. In fact, we tell the patients very clearly, it is an experimental thing. And for few people it does work.
Okay.
In fact, I've seen 2 women who had like 3 IVF failures, and then we were also planning to do another IVF for her, but we just wanted to try the PRP once. We did the PRP, the next cycle she conceived naturally.
Oh, great.
So you do see situations like this, right? And it does have some role, but then again, we still have to find the criteria of people we need to use it in and how we need to use it.
Okay, fine. So
it's not standardized.
It's not standardized, all right. And also for couples, like, do you feel that there is enough awareness created where before they start planning for pregnancy that they go meet a doctor, seek advice, check if everything is fine? And one is that, do they have to really do it? And second is that, what would be the benefit if they do it?
This is a tricky question because it's not required for you to really check your fertility, because when 2 people get together, pregnancy is not the first thing on their mind.
Yes.
Isn't it? So getting it checked is for someone who who know for a fact that they want to have children in the future.
Okay.
And if they're very serious about it, it's obviously important for them to get it checked.
Okay.
Nowadays, it's a lot of, boys and girls, they're coming beforehand itself. In their late 20s, they just want to get everything checked out to make sure they're fine. Especially boys who have been, taking medications for the, bodybuilding and everything else. Women who are wanting to, maybe keep their fertility journey on a later date. They just come in making sure they're all okay. So yeah, that is increasing right now. But again, as I said, I don't want to make that like a thing,
Okay.
It shouldn't be a thing. You just do what you're supposed to do at the right time. Things are going to be fine.
Okay. Again, ideal age to plan.
25. 25 to 30.
Of course, if they want to after that, but it comes with
it comes with its own risk.
Yeah.
Right?
Okay. Okay, so we are moving on to the myth or fact.
Yeah.
Okay. Okay. So they have put the questions.
Yeah. Okay. Good.
Standing on one leg to boost egg implantation.
Yeah, that's a different myth, right? Yeah.
Legs up after sex helps sperm reach faster.
Yeah, I think that is not only, it's not a myth. I think that is having some facts as well. You do raise your legs so that you do have the backflow of the semen inside. So I've seen people do that with, some results. So yeah, not really a myth. It could be a fact.
Okay. Chocolate and nuts at night improve fertility.
No, chocolates at night definitely is not good for anything.
Papaya smoothie for fertility.
Papayas also, they are, antioxidants. So definitely, I think it will be useful for fertility, of course.
Okay. Men should wear loose underwear for fertility issues.
They should not wear tight ones. So loose is their choice.
Okay.
Yeah.
But no tight.
No tight underwears, yes.
Okay. Does genes actually lead to reduced sperm count? I mean, this is not there, but just
depends on the
one
type
that
of
I've
genes. If it's
always
going to
heard.
be like skinny genes, no, then definitely yes.
Okay, great. Birth control pills cause permanent infertility, does it?
Not at all, no.
Okay. More sex, better chance of conceiving.
If it is during the fertility window, then yes.
Okay. Stress is the main cause of infertility.
Agreed, 100%.
Frequent ejaculation lowers sperm count permanently.
Not permanently.
Okay.
Only for the time being.
Okay. Laptops, radiation can make men infertile.
Not infertile, but definitely reduces their fertility, yes.
Okay. I am sure that you're not going to agree to this. IVF guarantees pregnancy.
No, it's only 30%.
Irregular periods means infertile.
Not at all.
Infertility affects only people above 35.
No, it affects anyone at any age.
And we have already, we did speak a lot about this. Fertility is solely a women's issue.
Not at all.
Not at all. Okay. I'm going to the rapid fire round.
Yeah, okay.
The most common fertility myth you encounter on day-to-day basis.
Oh my God. The most important fertility myth. Oh, I don't even know. I have so many,
Okay, countless.
I just can't. In fact, I talk on it all the time, so I'm just thinking which one is the most common. All of them are very common, Every day is a new day.
Okay, best food for reproductive health.
Anything with antioxidants.
Great. Okay. Top fertility test every couple should consider.
I think semen analysis for sure.
One natural remedy with scientific backing for fertility issues.
What?
One natural remedy with scientific backing.
Blueberries.
Oh, great. Okay. Biggest fertility challenge today.
Misinformation.
One thing everyone should know about IVF.
That it is not 100%.
Most surprising factor affecting fertility.
Surprising factor affecting fertility. I'm not able to understand the question.
Apart from whatever we know, this could also be a reason for your fertility.
Affecting your fertility. The place you stay, environment.
Oh, okay.
Yeah.
That's definitely surprising. Yeah. Best age to get pregnant. I think we've already answered that.
Yes,
25 to 30.
Yes.
Okay. Your go-to advice for hopeful parents.
Stay hopeful, be strong, stay hopeful, never give up.
3 things people should cut from their life for a healthy pregnancy.
Unsaturated fats, laptops, social media.
The last one is quite tough, I guess. Great. Now, also, before ending the show,
Yeah.
this is something I wanted to ask. Again, like from all your videos that I've seen, apart from the physiological causes that we say, what are the other pathological issues that we generally oversee or miss when it comes to infertility, or which has to be diagnosed?
Other than
The
pathology,
regular lifestyle, other
Yeah.
than the lifestyle issues.
Yeah.
See, most of the time we always talk about lifestyle
Yes.
changes, that stress and all of this.
Yeah.
But are there any other pathological issues that could also be the reason for the infertility?
I think the last one we spoke about, right? Social media, like that causes a lot of anxiety, isn't it? The more time you are online, the more anxious you become. Like, you see things. Obviously, the social media is there to show you things what you want to see. That's the reason why I don't browse social media at all. Whatever the videos, which I react to are all sent to me by my people.
Okay.
So they send me the stuff. They said, this is the most craziest thing I saw today. So you react to it. So I don't really spend time on social media because I do know, like once I am on it and once I keep looking into more and more reels, what happens is, it kind of is anxiety inducing, isn't it?
Yeah.
You'll be like, oh, okay, what's happening there? What's happening to my friends? What's happening here? Why is this happening to me? Oh, they're so good. So all of these things are going to, cause an impact on us. So I think definitely minimizing this
This helps.
is very important. I would say maybe use the screen time feature. I use that a lot. So even I'm sure, like, if you all go back to your phones, put the setting of screen time to 1 hour for social media, it should be good.
True. And again, with the rise of IVF clinics
Yeah.
all over, see, quackery again, we see a lot of quackery in dermatology. I
Yeah.
think equally you see in a lot of quackery in gynecology as well.
The problem is in our gynecology, our gynecs only are becoming quacks. See, because they stopped really treating the patients, right? You stop treating patients as patients, you're looking at them as commodities, right? You're looking at them like, how can I make the maximum out of this one person? And it's not their fault. It's because the companies, who are feeding them, they say that, you need this many number of cases this month for you to get your salary this month. If they say something like that, then obviously the gynec wants to do more number of IVFs, right? And these clinics only do IVF. Like, you go to them, if you have a pregnancy, imagine a gynecologist, you go to them and say, please, take care of my pregnancy. They would say, no, I won't do it because that's not my job. So how can you be a gynecologist and say you cannot take care of, the pregnancy, right? So that is where I think we need to draw a line. We need to go back to our roots, become gynecologists, treat the patient and not, the commodity.
Okay, before we finish, it's very, there are very few men gynecologists, I would say, like at least to my knowledge.
Yeah.
I'm not sure. Why did you choose to get into obstetrics and gynecology?
Okay, this is a very controversial thing, but what I have seen is when I first saw a laparoscopic surgery being performed, when I was like in my, in my college, I saw someone who was operating, right? And I saw that it was a woman who was operating. I thought, I can do a much better job than that.
Okay.
And then I started pursuing it from that day. And then, the rest is history. A very controversial take, but yeah, that's the reality and that's the truth.
Okay. No, in general, like when women take surgery, they're like, oh, women taking surgery.
Yeah,
It again happens when men enter into obstetrics.
Yeah. So I knew for a fact I can do a much better job. I knew I can definitely fill that one, niche and one that gap. And, I'm glad I found it at a very early age. So
Okay, great.
it became easier for me.
Great. Thank you so much for
Thank you,
being
Monisha.
here and giving us a lot of information that we don't know.
Yeah.
Sometimes what we don't know,
Yeah,
and
of course.
only we need to hear it from people who knows well about it.
Yes.
Thanks for being here and sharing your thoughts.
Thank you so much for having me.